I had Upper Asian blepharoplasty incision technique. Will the creases continue to look more even, go down? Hi, doctors. I'm very worried regarding my eyes. It has been post-op 9 weeks since my upper blepharoplasty incision technique. The creases still are uneven. Will this continue to lower or be more even in time? How long? When should I get revision, if necessary? Many thanks.
Thank you for your question. You had an incisional Asian eyelid procedure 9 weeks ago. You submitted a photo which shows a certain amount of swelling afterwards, and you're concerned about the height of the crease and whether you'll need revision surgery. Well, being a cosmetic oculofacial plastic surgeon for 20 years, I'm quite familiar with both the incisional and non-incisional procedures for Asian eyelid surgery, and have a lot of experience with revisional Asian eyelid surgery. So, understanding what makes Asian eyelid surgery a little bit different than non-Asian eyelid surgery helps you understand why the swelling is the way it is. So, when we talk about incisional or non-incisional Asian eyelid surgery, there's one specific goal to accomplish the development of a well-defined crease, and that is the connection of the skin at a specific height to the levator muscle or the levator aponeurosis. The levator muscle is the muscle that lifts the eyelid, like the word elevator. Now, in order to do that, whether it's a non-incisional or incisional, we're placing sutures from the skin to that muscle. And in a way, by doing that, there's a little bit of a tight space between the eyelash margin and the crease. Because of that tight space, there is a tendency to develop swelling. That swelling can temporarily elevate that crease, make the crease look like it's much too high. And so I suspect your doctor probably advised you of this, but what I tell my patients is this swelling can linger. I have had patients whose swelling from the eyelash to the crease has actually lasted a year. And so when we see our patients in regular intervals, usually at about 1 week for suture removal, then 1 month, 3 months, 6 months, ongoing, and of course with the door always open between those visits if they have any concerns. We've always observed that there's a dynamic nature to this procedure in terms of the ultimate result. At a certain point, one eyelid can be more swollen than the other. The creases can look a little bit asymmetric. They can look like they're too swollen on one side, or a little bit of swelling in the eyes can go a long way and have a tremendous impact on the appearance of the eyes. When I do this surgery, I essentially do this in a way so that I can be very accurate in terms of the predictability. In some cases, I'll actually have the patient open their eyes at a certain point. Of course, they don't feel anything, but I'll have them open their eyes and I can see how things look. And in other cases, especially if we're doing ptosis surgery at the same time, we'll actually sit the patient up and look at them to see how things look before some of the swelling starts to occur. So my recommendation is meet with your original doctor who did your surgery. It is only 9 weeks since the time of your surgery. And of course, you should be able to express your concerns and get an understanding of what to expect moving forward. So I think that you will probably be best off just waiting, but of course communicate with your doctor to anticipate how things are going and to understand where you are in the healing process. So I hope that was helpful. I wish you the best of luck, and thank you for your question.